Okay, so I hope you guys can see this. Yeah. Okay, so I wanted to talk about, and thank you for inviting me. But yeah, so I wanted to talk a little bit about hormones and PCOS, and just also like intro to functional medicine. Um, yeah, let's get started on that. So obviously it's a broad talk, so I just wanted to lay down some objectives so that we understand kind of big picture. Um, so talking a little bit about understanding the current model of healthcare, understanding what functional medicine is, which is what I practice, um, a basic overview of hormones, a basic overview of the menstrual cycle, which is important in PCOS, um, and understanding of what is PCOS and the main mechanisms, and what blood tests should be done, and what are some diet and lifestyle tips, and then what are some supplements that can be used for PCOS. So that's where we'll start. So I coined this term. It's called the PNP model of care. Um, so this is what I find out there. You have a bunch of symptoms, you take it to your physician, and the first thing that they'll do is throw a prescription or several prescriptions at you. Um, and so it's a very linear way of looking at things. So symptoms, and it's like prescriptions, not like let's pause and see what's going on. Let's evaluate the why. It's all just it's very reflexive. That can be for depression. That can be for various really any symptom you throw in there. It's or fatigue. It's just like let's try this medication. I'm not sleeping well. Let's try this medication. Um, and when that doesn't work, several prescriptions fail, then it's a procedure a lot of times. And this is something that women go through a lot, where they'll go to their gynecologist, and like let's say heavy bleeding is one issue. They'll get put on birth control, and if that doesn't work, then it's like you know hysterectomy or some other procedure. So this is the model that I see. I coined this term, and this kind of how the conventional world, as you guys know, is set up. So that leads to tunnel vision, essentially. And we have unfortunately compartmentalized, as you know, medicine into these different specialties. And what happens with that is that then each physician practitioner is looking at their own specialty and ignoring the rest of the body. And the body is not really designed for this type of approach, because all the different systems interact with each other. The GI system with the brain, the female system with the brain, everything is connected. But unfortunately, when we have these specialties, then we lose that. So you're going to your gastroenterologist for your GI issues, you're going to the neurologist for migraines, you're going to the OB for menstrual issues, right? And so there isn't that one person that's looking at everything. And that's the void that I'm trying to fill by that whole person approach. So that's the tunnel vision that we have. So what is functional medicine? So functional medicine basically takes a comprehensive approach to prevention, health, and well-being. So you've probably heard of this term root cause a lot. So we talk about root cause because we're trying to focus on not just the what, but the why. And the why is really important, because you could have two people that have depression, for example, and if you don't ask the question why, I think conventional medicine stops at the point where you describe all these symptoms and you get diagnosed with depression, and then the practitioner is like patting themselves on the back, like, okay, we got the diagnosis, and then the next step is medication and prescriptions. But the more important question is, why is someone depressed? So one person's depression could be very different from another person's. For one, it could be a psychological issue. The other, it could be an iron deficiency. And so that why component is very important, and that's what functional medicine is trying to address, essentially. And also, so this personalized patient experience is what I try to talk about, which is that um, no two patients should be treated exactly the same. That's important. So again, going back to that depression example, is where if you treat them exactly the same, one might need medication, one might need a whole different thing. And so you have to be very, I think, personalized in the approach. And so that's what functional medicine is. And why is functional medicine now important is because we now have this unhealthy society. Needless to say, is 50% of adults have at least one chronic health condition, and 25% of adults have two or more chronic health conditions. And this has led to an insane amount of spending for chronic disease. And this, unfortunately, it puts us in a position where We're going bankrupt as a country. Healthcare system is broken and going bankrupt too. Um, and this doesn't overspending doesn't necessarily lead to better outcomes from a patient perspective, but we're dealing with a whole epidemic of chronic disease that is just very difficult, and unless we take a more functional approach, we're not going to successfully treat this. So I see functional medicine very much as just putting the pieces together. So when someone's sitting in front of me, it's just like trying to figure out their symptoms and why this symptom particularly connects with this symptom, and just trying to put that whole piece together. That's what I'm trying to do with these patients. So that's how I see functional medicine. So now jumping into hormones. So hormones are, as you can see in this slide, you have a signal and you have a receptor. And so hormones are basically these chemical messengers that are going to attach to a receptor and then cause a particular effect. And so thinking of it like a key in a lock, right, where it fits perfectly into that receptor, so that the estrogen receptor is different from the insulin receptor and others. So it can fit nicely, it can then cause the effect within the cell. And so there's these chemicals that are going all around the body and implementing these very, very important effects. And they won't do that unless they have this receptor and a proper system going on. So that's kind of what this is trying to describe. Let's see if I missed anything. Yeah, muscles and just the way they control bodily functions, and obviously they're very essential for health. Um, Now, basics of the menstrual cycle. I do recognize that I'm a male, and I think one of the criticisms I get is like I'm, trying to educate women about something that they experience and I can't experience. So I get that whenever I put something online. But just speaking from the scientific perspective, so first day of menstrual cycle is first day of bleeding. That usually lasts somewhere from 3 to 5 days on average. And that's what we call the follicular phase, where that first phase is going to be where that follicle is maturing, getting ready for ovulation, and and also the estrogen will be getting the uterine lining more and more thicker for a potential pregnancy. So that's kind of what's happening in that initial phase. As you can see, the levels of progesterone and estrogen are fairly low. This is progesterone, the blue one, and the estrogen or estradiol is slightly higher, but very flat for the first part of the cycle. In the middle of the cycle, that's when the LH, the luteinizing hormone, kicks in, and that signal comes from the brain. And that sharp spike is what causes ovulation, and that one mature follicle and egg to be released into the essentially into the fallopian tubes and for possible fertilization. And the rest of it is basically corpus luteum, which will eventually regress or become the placenta if there is pregnancy. And then this is what also secretes progesterone, and that's why the progesterone levels are high in the second half of the cycle. So that's kind of just a little primer into the menstrual cycle from a lab perspective, and then you can see the spikes happening with the progesterone and estrogen then tend to happen later on over there. So um, now, what is PCOS? PCOS, or polycystic ovarian syndrome, is, first of all, it's a syndrome. So it's a collection of symptoms, not just like, one particular diagnostic criteria. You think about Hashimoto's, it's just like thyroid antibodies. That's a very basic definition of it. PCOS is a collection. And it's the most common endocrine disorder in reproductive age women now. So very, very important, very common, and it's estimated to be somewhere between 7 to 10% of women of childbearing age. That range is so wide because the diagnosis, there's disagreements around diagnosis, and a lot of women don't know they have it, so it's hard to estimate the exact number. And it's also the most common cause of infertility as well, which is a really important aspect in that world. But that doesn't tell us what's really happening. So what's really happening is at the ovarian level, you have these cells. There's a theca cell and the granulosa cell. And these cells are essentially, well, one of them produces testosterone. So the one on the left produces testosterone, and it produces testosterone actually from the base molecule of cholesterol. So that's why cholesterol is actually a very important, people are always vilifying cholesterol and thinking that it's just has all these bad effects and heart disease and everything. But it's a really important base for creating these hormones. So cholesterol is very important. It makes testosterone. As you can see, LH is the receptor here. So LH is needed in that situation. And then you have this cell, which is the granulosa cell, that is converting the testosterone to estradiol. So in females, testosterone gets converted into estrogen. And when I say estradiol, I'm talking about the main estrogen. And this process of conversion is called aromatization. And the enzyme is aromatase, this enzyme right here in the middle. Um, so that enzyme is converting that testosterone into estrogen, and that is where the problem lies, because the aromatase, for some genetic reasons, it just isn't as efficient in converting the testosterone into estradiol. So you're left with a whole bunch of testosterone and not enough estrogen, and that's the heart of the issue. Um, so the high amounts of testosterone that you generally will see in the blood, or androgens as a whole, is going to cause, acne, hair growth, some of the all the symptoms that we'll get into in a second. But that's really the mechanistic basis of it. So what you're left with then is high androgens like testosterone and DHEA, which is an adrenal hormone. You have then high LH. Now, why you get high LH is because back in this process that we talked about, the testosterone is not able to convert into estradiol, so your estradiol levels are low generally. Um, and so it's sending the signal to the brain that estradiol is too low, send more LH. So the LH keeps going up and up. So it's trying to get more converted, and it's just a roadblock. And so it's just a vicious cycle of high testosterone, high LH, and eventually low estradiol. And that's where the problem lies. So interestingly, historically, this might have been a survival benefit for women. You think of really, really old times, because PCOS has been around for a very, very long time. But when you think of it previously, you think about women having multiple children and the high rates of maternal mortality that comes with that. Then you think of, okay, if she were to have 8, 10 children, and instead she has PCOS, and that naturally gave her a little bit of infertility, or not infertility, but a little bit of less fertility. So instead of her having 8 or 10 children, she has 4 children. And so we think of that as PCOS, but that has a slight survival advantage for her. The other thing is that it will also increase testosterone in women, as we discussed. So it gives them that benefit as well of just having higher testosterone, which, you think about just more energy, more just being a bit more bold, and all the things that come with testosterone too, gives would give that woman a slight edge as well. And now we have a lot of a lot of controversy around testosterone levels and female athletes and all that stuff. Um, so there is a recognition that within women, within females, there is fluctuating testosterone levels. They're not, uniform. So even though they're not at the level that males are, but they're still fluctuating. And so historically, that's always been the case. And so those women are going to be phenotypically a little different, like externally, but also just in terms of personality and things can be very different. And so, um, so yeah, that's why maybe this is an interesting point about how previously it could have been a little survival benefit, but now we have endocrine disruptors and we have all of these unhealthy diets in the way that we are. So PCOS now is definitely a negative, as a lot of women suffer from. So main symptoms are going to be hair growth in unwanted places. Think of chin hair, sometimes chest, sometimes back, those things. Um, Acne is a big one. Fatigue and low energy. Irregular cycles tends to be a big one too. Infertility, as I mentioned, is the most common cause of infertility. Poor gut health, and we'll get into that in a second. Poor mood, weight gain, and obesity is oftentimes linked with it. Although interestingly enough, there's about 20% of women that are called lean PCOS, or in other words, they're not overweight, they're out, very thin, but they still have PCOS. So it doesn't have to be, and then that makes me very vigilant, is because sometimes you will try to look for, just whatever sign you can of PCOS, and sometimes it's very classical. It's just, it's very clear. Um, but in other situations, it may not be as clear, and that's when you have to keep in mind that there is a 20% where they may not be overweight at all. And then sleep issues. So it definitely affects PCOS. In fact, it turns your whole circadian rhythm around. So you tend to be a night owl, not sleeping properly. It's like being chronically jet lagged almost. Um, so lab tests for PCOS. So these ones on the left are the ones that I tend to do with most patients in general, whether they have PCOS or not. Complete blood count, metabolic panel, lipids, vitamin D, iron, A1C, thyroid panel. Just pretty standard stuff. I didn't include a B12 in there, but B12 is also important. But when you're talking about PCOS specifically, then these markers of total testosterone, free testosterone, and DHEA, S stands for sulfate, but DHEA is another androgen. So those are very important in diagnosing PCOS. FSH and LH, we were talking about those as the pituitary hormones from the brain that will that you can also measure. And when you have high LH levels, then you know that that's usually accompanied by PCOS. Estradiol, which tends to fluctuate quite a bit in the cycle, but you will see lower than average estradiol levels. Progesterone levels as well is important. And prolactin and cortisol are important just to rule out other causes that can look like PCOS, high prolactin and cortisol imbalances too. Now, the diagnostic criteria is important because there's a lot of not really agreeing with agreement on it, the exact definition of PCOS. So then you have these societies and they put out these guidelines. But in general, what most people look at is the first step is the high androgen, so above average levels of testosterone either in the blood or symptoms of it. Think of the hair growth we talked about and oily skin and all those things that accompany testosterone, and acne as well. And then additionally, having one of two of either irregular or absent menstrual cycle or having the polycystic ovaries seen on the ultrasound. And that you have to do with like a transvaginal ultrasound. But you can have one of or either or of these two. So in other words, you could have PCOS, which is polycystic ovarian syndrome, without even having the cysts on the ovaries if you were to have testosterone levels and then just the cycles. So it isn't always a perfect diagnosis. Sometimes I use this term called PCOS-like picture, where they don't neatly fit into the category, but it still is very clear. So we're still working on that. Um, Now, a few things about PCOS and how it interacts with different systems. So, with gut health, right? We know the importance of a healthy gut microbiome, which is important in digestion, immune function, hormone regulation. All that is really important. But women with PCOS, interestingly, tend to have dysbiotic guts. And when I say dysbiosis, I'm talking about an imbalance between the good and bad bacteria of the gut. Um, and one of the reasons for that is they tend to not produce enough of the mucus layer, that layer lining the gut, which predisposes to things like inflammation, leaky gut, if you've heard of that term, and also just more dysbiosis. So that's one thing where it goes back to that tunnel vision thing, is like, which gynecologist is looking at the gut, right? There's no concept of that. And that's what we're trying to understand is like, look, PCOS, we know clearly that it impacts the gut. There's a basis there. So in order to treat those women, you need to look at the gut. But unfortunately, there's a lag there. Um, and one of the other main things is estrogen, because estrogen is very important in maintaining health and integrity of the intestinal lining. So we think of estrogen as that quintessential female hormone, but it's very important from a gut health perspective and a brain perspective, because there are receptors for estrogen in the brain and in the gut. So it has many, many functions around the body, even in the nervous system, for example, that doesn't get appreciated. And again, it goes back to like, which GI doctor is thinking about estrogen as a focus of concern. So and then so women with PCOS tend to have less estrogen, and that's why there's another gut piece to it. um, PCOS and weight. So PCOS affects metabolism quite a bit, and estrogen is again at the heart of it, because estrogen is actually required to transport the glucose from the bloodstream into the cell, because you need it in the cell to make energy, to burn fat, all of those things. And so when you have lack of estrogen with PCOS, you're not going to effectively get that glucose through, and you're going to have more glucose in the bloodstream, which leads to more insulin secreted by the pancreas, so insulin resistance and all of the terrible things that come with insulin resistance, like inflammation and so on. So PCOS results in high levels of testosterone, insulin, and cortisol, which and gut dysbiosis also, which there's this complex web that then causes weight gain, and so weight is a big issue with PCOS. PCOS and skin, we touched on this a little bit, but you can get this cystic acne, and this isn't just simple acne, but very painful cystic lesions. Um, you guys deal with skin acne issues a lot. But yeah, when you have basically, you have high testosterone plus you have an inflamed skin, that leads to excess oil and an altered skin microbiome, and that together with the bacteria is just a recipe for acne breakouts, and so that tends to happen. Um, and yes, as I mentioned, it's very painful, and it shouldn't be discounted that it could be a significant cause of depression and poor self-esteem and all those things. So yeah, acne is a big one. Um, so what can we do about all this? That's all the theoretical stuff, but just talking a few minutes about practical steps we can take. So the first is dietary approach. And so for diet, there are some general recommendations, but for PCOS, what's really important is, I know this is hard to see, but just going to read this off, but basically focusing on whole foods as much as possible, focusing on plant-rich foods, so you're getting the most calorie, nutrient-dense and not calorie-dense foods. Trying to forego a lot of these ultra-processed foods that we always talk about. Um, that never is good with PCOS with all the inflammation that's already going on. Um, Eating plenty of fiber is really important. So fiber will feed the gut microbiome. You want to do that as much as possible. So good amount of fiber. Usual recommendation is around 30 grams per day. Some people are able to consume that much, so a good fiber supplement might be a good idea. Um, Making sure that it doesn't have any additives, any artificial sweeteners and things like that. Um, and then um, yeah, and then incorporating nuts and whole grains, and ensuring you have some meat and poultry. Just a balanced diet is really important. But that's very important. But I think not only is it important on what you eat, but also when you eat. So I talk a lot about time restricted eating, because what we tend to do is we tend to snack throughout the day and sometimes snacking late into the night as well. And that's never good for PCOS or just in general metabolic health. And so trying to find regular intervals of meals, breakfast, lunch, and dinner, and having breakfast generally as the biggest meal is the best, because that's when your insulin sensitivity is the best, and eating a lot later in the day is generally not the best idea. And then so finding ways around avoiding snacking between meals and avoiding the late night. So let's say you take 7 a.m. to 7 p.m. and that's the window in which you're going to eat, and the rest of it you're going to try to basically fast in that. That's usually the best for PCOS. Lifestyle, it's very important to focus on obviously exercise and movement, because aerobic exercise not only improves insulin sensitivity and all the traditional things we think of, like healthier heart, lower blood pressure, weight improvements, but exercise actually has a tangible benefit on your gut microbiome, and it can actually change your gut microbiome in a way that food may not be able to do. So exercise is good in its own way for the gut. Um, Stress is obviously very important, because it raises cortisol levels, which can impact weight gain, inflammation. So it's very important to try and use effective stress relief techniques. Obviously, there's a ton out there, and that's a whole talk on its own. But just finding what works for you, because there's no way to get rid of stress. It's just about how to manage it effectively. And then sleep. Sleep is very important, like I mentioned at the start, because sleep deprivation will actually lead to higher levels of insulin and more insulin resistance, more weight gain. Women with PCOS tend to have sleep apnea and sleep disorders at many-fold higher than women without PCOS. So, things like sleep apnea, those sleep-related disorders are very common. So sleep is really important. So it all comes back to hygiene. So making sure you're getting to bed on time, getting enough sleep, a dark room, temperature regulation. Some women use the mask, right? That can help. Noise levels, not making sure you don't have caffeine later on in the afternoon. Um, Water, also like your water intake. If you have a lot of it in the evening, then you're getting up to go to the bathroom a few times. That affects sleep. So sleep is in general just very important. So that's a few lifestyle tips. Living clean is another one. So I talked about endocrine disruptors at the start. Endocrine disruptors are these dangerous chemicals that what they do, they're all around us. Plastics and things like that. So if you look at this diagram, you have this hormone here that's supposed to attach to this receptor, and then the effect of that hormone then takes place. But when you have endocrine disruptors, you'll have this endocrine disruptor that goes and binds to the hormone, so that now, binds to the receptor. So now the hormone isn't able to bind there and do its job. So um, that's important because even if you have enough hormone there, if it's not able to bind to the receptor and do its job, it's of no use. Think of like you're delivering a package to a door, no one's home, then that package is useless because it can't get into the house. So that's really important. So living clean. Now you've heard of BPA and phthalates and dioxin. These are all examples of environmental endocrine disruptors that we just can't get rid of. We can't get away from. They're in our foods and in our a lot of our products, right? You guys talk about probably like clean products versus all that stuff. So that's all about BPA and the endocrine disruptors. And that's what makes PCOS and so many other hormone issues so much worse because we're dealing with that constantly. So um, yeah, and then supplements to consider. So I tend to like myo-inositol quite a bit. Myo-inositol is a type of inositol that it improves insulin sensitivity. It lowers inflammation. It actually helps with ovulation as well. So some women that are struggling with cycles, myo-inositol can help them get regular cycles too. Alpha lipoic acid is a really, really potent antioxidant. Um, it's really good for blood sugar regulation. And I've had patients with diabetes or some with just abnormal like insulin resistance, and they've used it and have had improvements in those things. So alpha lipoic acid is a great antioxidant, great for blood sugar regulation too. You can use it in IV form. You guys might have it. You guys might, yeah. So I've used it a fair amount in an IV form, which is very powerful in lowering blood sugar. I've actually had one person able to get off of his insulin entirely by like a decent amount of insulin by losing weight and using alpha lipoic acid and just not on insulin anymore. Um, Probiotics, I included probiotics just because gut health is very important and central in PCOS. And so just making sure that you have a healthy gut microbiome, and that can be helped by probiotics. Vitamin D is a really important, not just vitamin, but hormone. It has roles in immune function, as an immune modulator, inflammation, as bone health, helps your sleep. So a ton of things that vitamin D is helpful for. So ensuring that levels are checked and getting those levels up is in the range is important. Um, L-glutamine is another gut-specific supplement. So when we talk about leaky gut, a lot of the products for leaky gut have L-glutamine amongst other ingredients. Then we have things like zinc. Zinc is really good from a skin perspective. So skin and hair, zinc is really good for. Magnesium, right? When you think about cortisol levels, high stress, um, it is helpful from a gut perspective as well. So magnesium is really good. Omega-3s are just good general supplements, but there's a ton of others, a long list, but I just want to include some supplements here. Um, so to summarize, PCOS is basically occurring due to abnormal aromatization, that process that converts testosterone into estrogen or estradiol. That's really at the heart of the issue. It's the most common endocrine disorder in reproductive age women, as I mentioned. It's a syndrome, so it's a constellation of symptoms, not just one thing that defines it. We really need a holistic approach to tackle it. So, that's the pain point when you talk about primary care physicians or gynecologists or endocrinologists. No one is really looking at everything. It's just everyone is just looking at it from their perspective. And so, um, strong connection between PCOS and gut health that gets underappreciated, and diet and lifestyle are very important to improve PCOS. So that's important. And then supplements should always be tried before pharmaceuticals. I mentioned that because the first thing is always birth control, as you know that it's kind of reflexive. 16-year-old girl, irregular cycles. Maybe she has the onset of PCOS, and it's like, here's birth control. And then 12 years later, they're trying to figure out their health journey, and that's when I see them, and it's like, what do we do now? Um, so yeah, so trying things, before metformin, before birth control, before other things that can be done pharmaceutically, trying the supplements that I mentioned on the previous page, as well as all the diet and lifestyle measures too. And that's it. Um, I try to put stuff on YouTube and Instagram and all these places just to talk about PCOS and other hormone issues and all that. So definitely check that out. And yeah, thanks for listening.
Thank you.
Yeah.
So I did have a quick question. So what are your thoughts on, just for the fact that I feel like the whole world's on semaglutide? I mean, I'm on it, or has been on. I mean, everybody I know
Yeah.
has been on it or is on it.
Yeah.
What are your thoughts about these GLP-1s in relation to reversing the chronic disease? Things that are, now people have chronic diseases because of obesity, because of all types of things, and now these GLP-1s are out, and people are seeing that their cholesterol is down, their blood pressure is down, their their overall health is better.
Yeah.
What are your thoughts about that?
Yeah, I mean, I think it's a great way to sort of fast track that end result that we're trying to achieve, right? And so I think that it's incredibly powerful, as you guys have experienced that, in trying to get those changes that otherwise people are trying the dietary lifestyle, all the supplemental route, but aren't able to get. In my patients, sometimes it's like can't get there, and we've been trying for a year, 2 years, and then you go on something like semaglutide or Manjaro, and it's like, wow, my inflammation is down, my weight is down. So I do think that it has its place because it's incredibly powerful, and it's the effects of it are what is going to lead to those health benefits: lowering the cholesterol, lowering inflammation, lowering the weight, which is such a driver of a lot of these things. So it's going to have that, but obviously, just like anything else, it comes with its caveats, and you're gonna, to some degree, lose muscle mass as well, and all the things that you've heard around those issues. So in a balanced way, I'm in favor of it, but usually never as kind of like a first line, like we're doing everything, and then when we've exhausted, it all, then I would use semaglutide. So or Manjaro. So I think it's just about meeting the patient where they're at, and I definitely try not to jump to it because there's issues around cost, and there's availability, and then side effects and things like that. So I'm not against it. I think that it has, in some patients that I've seen, tremendous benefits, but as long as they just follow the right steps, and that's like my thing with everything is, even okay, like there might be a role for birth control as well, but way after you've tried everything else and you're using that as a last resort. Just as an example. So that's kind of how I think about it. Any other questions or thoughts?
Do you work with women like on a regimen or like for like getting off birth control?
Yes, I do. There is really like probably no way of like easily tapering it, or there's nothing fixed there that's like how to do that. But I think that for most in first of all, I never prescribe it. I mean, really, outside of contraception, I don't, it should never be used, right, because of the tremendous amount of negative effects and these tools that we do have to try and get things better. But I think the discussion around getting off of birth control is basically that, if you once you become really fed up with those symptoms and taking it, at what point do you say, okay, let me just try off of it, allow your body some time to get back into balance, and then support it in other means, the gut and hormones in general. So I don't know if that answers your question, but it's basically like it's pretty individualized. Like there's some patients that I'm not ready to come off of it. Okay, let's give it some time. Let's work on other aspects of health. Maybe your vitamin D is low, maybe iron is low. Let's just help that. And then once after that, we can see where you are, and then maybe get off of birth control, maybe keep it going for a little while.
So would you recommend getting hormones checked first and then
Yeah,
seeing?
the problem, one of the issues is that when you are on birth control, those hormones are affected accordingly, so you don't get really accurate levels of what you naturally would be doing.
Right.
So that's the challenge with birth control a little bit, but it's still good to check it. And then there are other more detailed tests you can do, like the Dutch test, which is a urine hormone test that can tell you some more detail, like how you metabolize hormones and things like that. So,
How long do you recommend if you're doing something like trying to get off the birth control and trying to, just regulate your hormones naturally? How long do you recommend being off of birth control before you feel like you're in a good place to get your hormones checked and actually get a good picture of where you are?
Probably a few months, somewhere in between that 4 to 8 weeks, or I think it depends on when symptoms level out a little bit. Probably no exact time frame, but a few months, I would say. Yeah.
Questions
Yeah.
on the supplements.
Yeah.
What do you think about berberine?
Yeah, berberine is a really good one too. Berberine, I like using it a lot from the lipid and metabolic health perspective, also from the gut perspective. So it can have a dual purpose to it, because it's antimicrobial, which means that it will act almost like an antibiotic, like a natural antibiotic to the gut. Um, so really good one, especially if you have insulin resistance, if you have weight. Weight is also an issue. High lipids is an issue. Then berberine is great. Um, you may not want to use it continuously for a long period of time just because of the effects it does have on the gut. Um, because you think about when we talk about like oil of oregano and these ones that are wiping out the bad bacteria, and you're just doing that constantly. So I'll have patients that will do it for maybe like 3 months and then take a break or stop. So the idea is to use it temporarily and then get off of it. But
Is there a probiotic that you recommend? Is there one that you like better? Because there's so many.
there's a lot, yeah.
Yeah.
Yeah, there's honestly, probiotics sometimes confuse me as well, the amount of out there. There are, generally speaking, there's like overall three categories of them. There's a what's called the lactobifido, which is the lactobacillus and bifidobacterium, and that's more of a general probiotic. Most of them contain that. Then there's Saccharomyces boulardii, if you've heard of that, which is comes into that almost that fungal category. And then there's the more soil-based probiotics. And so I tend to like those lactobifido ones. Designs for Health has a really good one called ProBiomed. That's on Full Scripts and these other places, but I like Designs for Health as a supplement company. And then what else? The Microbiome Labs has a few really good ones. They tend to focus a lot on gut health. So their Mega Spore Biotic is their main spore one. Um, so yeah, some of these like orthomolecular Designs for Health are pretty good supplement companies. Um, the quality you're getting on Amazon in these places is always questionable. So it's always good to get like one of these more reputable companies generally. Yeah, yeah. Probiotics it's just a big world out there. So and it keeps changing. So it's like yeah, yeah. Okay, awesome. Thank you.
Thank you.